Hey folks, this is my first Periscope, and I thought I wanted to share a couple of hints and tips and ideas for developing nurse leaders. So here we go. 5 things that really come to mind. The programs that I run at work, we've got thousands of leaders. Hello, AJ. We've got thousands of nurse leaders who've come through it, so we've got a lot of stories about what they wrestle with. So specifically, 5 things that nurse leaders wrestle with that if you're in healthcare you can tackle. So the first one is giving direct, honest feedback. Nurse leaders have a really hard time doing this. They have the problem of hurting people's feelings. They have the fear of folks getting upset and working with patients. So Gary Playa, I work in healthcare for a large healthcare company, run the leadership development program. So giving direct feedback is the first thing that they wrestle with, and it really is hard for them to get past this. But with help and support and understanding how to do it, they can do a fantastic job, but it's one of the challenges and fears that they have. The second one, peer today, boss tomorrow. For many of the nurse leaders, they're leading teams that they used to be a peer with. Sometimes they're going to be leading people who are older than them, more experienced than them. So they wrestle with, how can I give direction to somebody who's been doing this longer in the industry? This is something that they really do wrestle with quite a bit. And so you have awareness of this, you can actually specifically support them and help them. A couple of great comments coming in. Nurses don't get managerial training. No, they don't. They're trained to be clinical nurses, very functional, specific knowledge, but absolutely they don't get that kind of training before they have to jump into it. The third thing, influencing others. Nurse leaders can give direction to their staff, and there's certain things they're challenged with around that too. But for many times they have to influence others' behaviors and actions to follow what they need to get done, but yet they don't report to them. Sometimes they have to do this with physicians, other clinicians, other nurses, and it is a challenge. They are not trained on how to influence others and the nuances of doing it. So that's the third big challenge that frontline nurse leaders deal with. The fourth one, dealing with difficult people. This is one of the ones that I hear nurse leaders tell us most often. A couple of questions here. So any ideas on standardizing healthcare, developing countries where cultural taboos are so? That is a big one. I don't know I could cover that tonight, but specific to nurse leaders, dealing with difficult people, they really do wrestle with this too. It's very similar to giving direct feedback, especially if you have to give direct feedback to someone who they perceive as being difficult. So this is something they struggle with as well. A future talk, it is a very interesting idea, Gary Play. If you wanted to follow me, I'd be happy to follow you back and see if we could connect on that. The fifth one, delegation. Nurse leaders are used to doing it themselves. They're used to being, oh great, excellent. They're used to being a high performer on their own. That's probably why they got promoted to their position. So the great of that is they know their work. The downside of that is they're not used to delegating to others. They're used to jumping in and taking care of it themselves. So delegation is an extra challenge. When you combine the concern about delegating to others and getting past the fear of having other people do the work while nurse leaders shift to leading them, add to that the peer today, boss tomorrow concern, add to that the fear over giving direct, honest feedback for fear of hurting somebody's feelings, all of these pieces come together and create a huge struggle for our frontline nurse leaders. And these are the folks that are leading the people who are interacting directly with our patients. So their ability to engage our nurses is critical to having great patient satisfaction and great, honestly, clinical outcomes. So a couple of tips. You got to build their confidence in doing what they need to do. The challenges with that is that they're not going to have confidence until they have competence. So that's a little bit of a shout out to my situational leadership too, folks. So when you help a nurse leader to develop competence in how to be a leader, the basics, the absolute ground level foundational items then that's when you help them to have confidence. They can't have confidence if they don't know how to do it. Just like any other clinical education that they go through, you focus on competence first, and somebody, usually a preceptor, observes you and checks off to see that you do that. Well, who's doing that for them in the leadership development space? So if you are a nurse or you have anything to do with developing nurse leaders, please help them to have the competence in these basic leadership functions, and then support them so that they have the confidence to do it. It takes a lot of courage to be a nurse leader and lead other nurses, especially in the environment that they're in. But if you provide them these very couple of simple tips and awareness of what they're struggling with, then you can have a greater outcome. So again, the top 5 are, and again, the top 5, these are things that are reported to me and my team over the past several years and the thousands of nurse leaders that we've had come through our programs. So number 1, giving direct, honest feedback and not hurting someone's feelings. Number 2, peer today, boss tomorrow, leading people that you used to be a peer of and who may have more experience than you. Number 3, influencing others, especially who don't report to you. Number 4, dealing with difficult people. Number 5, delegating to a team. So 5 quick tips, 5 quick areas of focus for nurse leaders. If you can help them to get past these 5 things and build their competence in them, and then let them have time to practice and build their courage, then they'll have the confidence. When they have that, then that creates the motivation to learn more and to be more and to stretch themselves. So thanks a lot, folks. I appreciate it, and all the folks who commented and liked this. And we'll be doing some more. The next one coming up is developing physician leaders, and so that one should be pretty interesting. Have a great night.